Welcome everyone, and thank you to those joining us live and those listening in afterwards. I'd also like to warmly welcome our guests today, our pharmacy heroes, who I'll be introducing to you very shortly. I'm Nadia Bukhari, academic pharmacist at University College London in the United Kingdom and global lead for gender equity for the Workforce Development Hub at the International Pharmaceutical Federation. FIP's vision is a world where everyone benefits from access to safe, effective, quality and affordable medicines and health technologies. Our mission is to support global health by enabling the advancement of pharmaceutical practice, sciences and education. We're pleased to be delivering this event, the 11th one in the Responding to Pandemic Together series, but also the third Hearing from Our Heroes episode. We know that the world's pharmacy team is fighting COVID-19 everywhere, working closely with other healthcare workers and often putting their lives at risk to protect and care for patients and the public during these times. So, as part of this online program, we will be featuring regular Hearing from Our Heroes webcasts where we talk to pharmacy heroes from different countries, learn about their experiences and share those stories with you. In partnership with our FIP member, the Pakistan Pharmacists Association, PPA, we have a national focus on Pakistan to recognise the various sectors within the profession who are at the front lines of the pandemic. How is Pakistan dealing with the COVID-19 pandemic? What challenges are facing the profession? These are the questions and many more that we'll be addressing today with our panelists. So we have a great lineup today, and I'd like to introduce our 5 panel members. Firstly, we have Mohammed Alamgir Rao, who is a pharmacist, a PhD scholar as well in pharmaceutical chemistry. He started his career as a hospital pharmacist from Karachi at 7 Days Adventist Hospital for 6 months, and then worked in sales and marketing for 3 years, up to the level of district sales manager in the shortest time in a multinational firm. In 2008, he joined the government of Punjab as a drug inspector BPS 17 and worked there for 8 years at different districts and remained the focal person for task force on counterfeit drugs for the Multan division. In 2016, Alamgir joined procurement side with the Directorate General Health Services in Punjab as a deputy director in pharmacy, and he's currently working as a director of procurement in Punjab and is the focal person for logistics and supply chain during COVID-19. That's a bit of a mouthful, that one, for Pharmacy and Secondary Healthcare Department Punjab. And if that really wasn't enough, Alamgir is also the General Secretary for the Pakistan Pharmacists Association since 2017. Welcome, Alamgir.
Thank you.
We also have Dr. Bisma Nair, who also is a pharmacist, PharmD. She started her career as a community pharmacist back in 2013. Currently, she's managing the Breast Cancer Initiative in the Ministry of National Health Services, Regulation and Coordination in Pakistan as an aspiring public health pharmacist. Along that, Dr. Nair is playing her role in the Pharmacy Reforms Chapter Pakistan digital platform and the emergency response module based on COVID-19 by the Yaran Watan Pakistan Health Diaspora Initiative. She's also pursuing a Master's of Philosophy from King's College in London. Very warm welcome to you as well, Bisma.
Thank you, Nadia.
We also have down the line with us, we have Dr. Laikul Rahman Khan, who is also a pharmacist and he graduated from the University of Central Punjab in Lahore. He's currently working as a hospital pharmacist in the Tehsil Headquarter Hospital, THQ, in Palia District, Mandi in Bahauddin. Here he has been nominated as the focal person for the nutrition program, focal person for electronic print and social media for the hospital. More importantly, he's a focal person for the COVID-19 response for the hospital as well. And he has authored a few books. He's authored a handbook very recently on self-care strategy against COVID-19, and he reports directly to the Chief Minister for the Corona Cell. So warm welcome to you, Lake.
Thank you, Nadia.
We also have Dr. Asma Hamid on the line. She is the head of pharmacy services for Dow University Hospital, which is also the WHO COVID center during the pandemic. She is a pharmacist. She's also got an MBA in health and hospital management, and she has more than 20 years of experience in the field of hospital pharmacy. She's also had experience with Aga Khan University Hospital for more than 18 years and has worked in a managerial capacity. Her key specialized areas of working are inpatient and ambulatory care, pharmacy services, as well as specialized services such as sterile and non-sterile compounding for oncology pharmacy. A warm welcome to you, Asma.
Assalamu alaikum, everyone. Thank you for inviting me on this auspicious platform to share my views and experience being as a pharmacist in a hospital sector. Thank you so much.
Rahman wa alaikum assalam. And last but not least, we have Dr. Huma Rashid. She is a researcher, a practicing pharmacist, and a health activist with 2 decades experience of working in diverse areas of the health sector. She was a gold medalist student of her time, and her professional career started as a pioneer intern at the Shaukat Khanum Memorial Cancer Hospital back in 1995. She has to her credit the leadership of teams for establishing important pharmacy institutions and services in Pakistan, including the Children's Hospital and the Institute of Child Health, Lahore, back in 1999, where she served for a decade as the first ever clinical pharmacist in the public sector in Pakistan, and deputy chief pharmacist with achievements including initiating technical and clinical services such as TPN and extemporaneous preparation for rare metabolic disorders. In 2008, she founded the Institute of Pharmaceutical Sciences in University of Veterinary and Animal Sciences, where she's currently working as an assistant professor for pharmacy practice and pharmaceutics. And she has worked for the establishment of the first WHO and Ministry of Health approved bioequivalence study center of Pakistan. In 2019, she completed her PhD from Germany on devising cost-effective measures for quality control of pharmaceuticals in low middle-income countries on Higher Education Commission scholarship. She is the president of the National Alliance for Women in Pharmacy in Pakistan, and she is an active advocate of gender equity and women empowerment in Pakistan. Again, a very warm welcome to you, Huma.
Thank you, Nadia. It's a pleasure being here.
So we obviously will be speaking about COVID-19, and I'll be asking you all a series of questions. So I think we'll go around how I'm actually seeing you on the screen. So firstly, I'll start with you, Alamgir. How is the pandemic being dealt with within your district? Because you're all from various districts within Pakistan, which is quite interesting. So it'll be interesting to also hear, and for our audience to hear how the pandemic's actually being dealt with in your district.
Obviously, I will talk about the whole Punjab being focal person for COVID logistic management for whole Punjab, not for any particular district. But as far as the COVID management is concerned, I'm particularly dealing with procurement and supply chain of PPEs and other logistic for COVID-19. Basically, the COVID-19 started in Feb in Pakistan, and initially it was very progressing very lower side, but currently it's growing very higher side. In last 24 hours we have entered around 2400 patients in Pakistan. This is the biggest number ever for last 3 months in Pakistan. So the trend of patients is being increased in Pakistan, but fortunately I will special pay to thanks to Allah that death rate is still very low in Pakistan. That's around 2.5, and we hope it will remain the same. Being pharmacist, I have seen a lot of things happening in Pakistan that were previously not being done, right from the perspective of association as well as the hospital pharmacist side. Once we heard that COVID-19 outbreak and there was shortage of everything in the Pakistan, like PPEs and other, even sanitizer was short. And I was very glad to see our young pharmacists and future pharmacists were in the hospital, just took the guidelines of WHO from website and started making the sanitizer at their own level, not at for their hospitals, even for community as well. And it was a marvelous step. I communicated these kind of activity of pharmacists even on my social media as well as on high ups in Pakistan and the policy makers as well. So Alhamdulillah, there was no shortage of any such kind of sanitizer or antiseptic solutions everywhere in Punjab because of our young pharmacists who dealt it very well. Then the basic role of pharmacist is majority of the pharmacists are dealing in hospital side. I see is the management of logistics majorly, because procurement is done at the center level as well as few donations or other our authorities like National Disaster Management Authority, NDMA and PDMA are also providing some sort of logistics. Mainly I myself and my department, primary and secondary healthcare department, Director General Health, are also procuring and providing PPs and other logistic to all health facilities across the Punjab. But what I have felt is the major issue was the shortage. Currently, there is no shortage, Alhamdulillah. But in few months like March and April were the worst month when everything was short and nothing was available. Flight schedule was also disturbed, and that was a major challenge in Pakistan to cope up the situation. But Alhamdulillah, we have faced it very well, and there was nothing short in Pakistan. And currently, there is an ample quantity of everything available. Alhamdulillah. Basic then management of COVID is concerned. Our health department and Director General Health Services made teams who went every district for training of the person dealing with COVID, involving the healthcare professional like doctors, nurses, and pharmacists, particularly for the usage and of the PPs as well as the incineration and destruction of waste management protocols as per WHO guidelines of the PPs. This was the major step taken in our Punjab side, that every district was in loop, and team, I think 3 cycles were incurred in Punjab for training purpose only at district level. Then the major challenge I faced was the specification around, because everyone in Pakistan, there was another issue I faced in last 3-4 months, that when we saw the things are being short, the stockists stocked the stores and pick the bulk. And second thing is that most of the people started to make their own level PPs without any standardization, means gowns and face masks, even N95 is being manufactured in Pakistan. But unfortunately, their standardization and quality is a bigger challenge. And second challenge is that there is no specific laboratory which can test all the tests relevant to their quality and things. But we followed the WHO guidelines for procurement perspectives, and as per WHO guidelines, we processed in the tender process and we procured all the like goggles, gowns, and face mask and 95 mask, obviously, and all other things.
That's great. I want to stop you there because I'm going to go around asking the first question, and then we'll come back to the second question. And you're obviously, you're doing amazing work, and a lot of it. And it's great to hear as well that you're liaising with WHO guidelines, and you're interacting with WHO Pakistan as well in order to fulfill the requirements. So that's absolutely amazing. So I'm going to move on to Lake. I think Lake, you're down on the phone. So Lake, how has your district responded? Firstly, if you can actually tell us which district you're from, and how is your district responding to the pandemic?
Okay, actually, I'm working in THQ Hospital, Phalia district, Mandi Bahauddin. And my district is very active in this whole race against the COVID-19. First of all, I would like to share that I'm also a COVID-19 positive patient. I got a positive test, and I'm being kept in a isolation center in a district headquarter hospital away from the outside world, just to protect my fellow beings and people around. So first of all, as a pharmacist, we need to understand that it is not the virulence and the fatality, but it is the infectivity of the virus that is more lethal. A virus that affected about 4.4 million people around the world, and deaths are over 300,000. What a pharmacist can do in Pakistan? So our district engaged these pharmacists. They made them the focal person. There were different tehsil headquarter hospitals in my district. There were several focal person from these Hospitals, they were reporting directly to the CM portal. They were given different portals. Whenever a suspected case used to come, they used to report the suspected case, and the samples were being taken and sent. And then we used to follow those samples to the time when they were either being given negative and discharged, or being given positive and being kept in isolation or quarantine centers. So we were doing that directly to the Chief Minister Corona Cell. We also collaborated with the army, the rescue teams, and the police, and also to the other state departments like our agencies. We were directly reporting to them. And we, being pharmacists, also engaged with the infection control teams here in our district. We were being trained by our CEO offices and our district health authorities, as Sir Alamgir Rao told you. And at the time, in our district, the hospitals were not very much functional with respect to the OPDs, because the corona outbreak was very lethal, and we were directed not to operate the OPDs. But at the similar time, all the dispensaries and the pharmacies were open. The pharmacists were there. They were counseling. They were giving the medication at the time when it was very dangerous for them to interact with the patients directly. There was also one time that there was a shortage of the sanitizers, the PPEs. So what we did follow the WHO recommended hand of formulation guidelines. We procured hundreds of liters of ethanol, and then we made the sanitizer. And not only we gave it to the hospital, we gave it to other departments that were working under the government level. All the community pharmacies were working. All the drug inspectors were out on the field, and they were checking the quality of the drugs. So we had so much to do, and we did. And after every visit of any corona positive patient, I used to go and make sure that it was all cleaned by the chlorine wash. But unluckily, I also catch the virus, and now I'm also a victim of it.
Thank you for that, Lake, and we wish you a speedy recovery, and thank you for joining us despite that and sharing something very personal of the diagnosed with COVID positive, being COVID positive, and the amazing work that's been carried out in your district as well, you know, involving the State Department, manufacturing liquid hand gel. Amazing, the work that you guys are doing. So I'm going to now move on now to the next, our next panelist, Huma Sheev. Tell us how your district are dealing with the pandemic.
Well, I'm from Lahore, and what I have seen is that initially it was not so that that the strict lockdowns started to be experienced in our cities. It's a bit different response from Karachi. Karachi had taken more strict response. In Lahore, it was not so. But all of a sudden, around March, all the schools and universities could close down. Market closure was there. At 5 o'clock, everything closed. But the interesting thing was this, that the pharmacies did not close. And everything means even the GP clinics in the surroundings also closed. So that's the only accessible healthcare professional who was present and accessible was pharmacists. And it was profoundly acknowledged by the patients. They had to share not only their regular queries about their current problems, but also what is this pandemic and what is this virus, how is it different, and we need to tell them that okay, it's 80% people do not even get the symptoms, but 20% get the symptoms, and not everyone gets very bad symptoms. But what we can do as people, the first thing, they had to be recalled the lesson of hand washing. So this was the first thing which needed to be spread. And then at the same time, around that National Alliance for Women in Pharmacy in Pakistan also came up with the guidance things, in which Bisma and you made this very interesting and good document. And I also participated at the end stage. And so the query which was in the pharmacies was this: what we can do. So we said, okay, wash your hands and then use this technique. And then third thing, that if you use some disinfectant, which disinfectant can we make them at home? Okay, you make it from the laundry bleach. Then you have to take the dilutions. Not only the patients were asking this, other healthcare professionals were asking, so why don't you train us? How do you do that? So then so more and more, the queries coming in and pharmacists answering it, I felt that credibility of pharmacists raised. profoundly. The pharmacists, which was like present nowhere, all of started becoming very present everywhere, And then the query is about, okay, there's very interesting thing about the information coming in and it's not accurate. Okay, can we use this medicine? Can we use the medicine for prophylaxis? And we have to reassure them, no, you don't have to do this. Do not go into panic phase. So pharmacists had a very important role while the administration in the city, in the district were into lockdowns and things were closing and people were tried to be held in homes. They had only access to pharmacies, and it was very important that the people in the pharmacy, whether the pharmacist or the other pharmacy staffs, they need to be trained on what to answer and answer with confidence and with empathy. So this is how, and further we can elaborate during the further questions.
That's great. Thank you, Humayun. And it's a really important point you raised there, that the pandemic has really brought the pharmacists out to the forefront, because due to lockdowns, the only accessible healthcare profession is the pharmacist. So thank you for that, Huma. Bisma, how has your district responded? So I believe you're in the capital territory of Islamabad.
Oh, yes, yes. So excellent experiences shared by my panel colleagues. So at the capital, at the heart, at the ministry, where we are trying to contain the pandemic. As of today, 48,000 people have already been infected. There are current cases of it. So as Alamgir said, that no ever this collective response has been there at national level. So that's because the Ministry of Health and Government of Pakistan, they were like on top of it from the start. At the start, there are like 4 testing facilities, but there are more than 50 now. A daily 30,000 tests are conducting. There have been a massive drive for the TTQ, in which the pharmacists are involved. They are tracing and contacting the contacts and keeping them in quarantine. Then there is COVID helpline 1166, which have been established by the government of Pakistan as well, in which the patients who have suspect that they have COVID, as Huma rightly said, that in lockdown, and in as per now, when the lockdown has been eased, the OPDs and the private clinics are still closed. They haven't been open yet. So these are this helpline for the patients. If they suspect it, they can check with the doctor. And then recently, the Ministry of Health launched 2 telehealth initiatives, Yarane Watan and the telehealth.gov.pk, which is by Digital Pakistan. So what these 2 initiatives do is, one uses the local doctors as a volunteer, and the other, the Yarane Watan, uses the overseas healthcare professional, and they are integrated. They are connected by the WhatsApp COVID chatbot. Whoever contacted at that number for the symptoms can talk to a doctor for free. So these are one of the key initiatives which we are taking, and we are monitoring the situation day by day. There are meetings and briefings in NCOC on the daily basis. A huge work has been done on the API modeling, on the projections, that which guides the government, Ministry of Health, that okay, we will need these numbers of PPEs. We would need these healthcare professionals to help this out. We need that number of ventilators, and those kinds of decisions, those kinds of public health interventions, they help really the government to deal this with the pandemic. So as you can see, as we can relate to Italy and USA and UK, the numbers are very high, And but fortunately, our CFR are very low as compared to these countries. But still, we don't need to relax and just go out for each shopping. We still have to stay at home as much as we can, and follow precautions and SOPs for social distancing.
Thank you so much, Ms. Mann. You're absolutely right. I think Eid is not far away now, and that poses a great risk. And it's a bit of a conflict as well, because you want to spend time with your family, but we're amidst a pandemic. But I'd also like to congratulate Pakistan on how they have, and the government of Pakistan and the Ministry of National Health Services on their response to the whole pandemic. I have to say myself, when I came to Pakistan in February, at that time, there was COVID screening happening at the airport. So, an amazing response, absolutely. And Asma, can you hear me, Asma? How has your district dealt with the pandemic?
Definitely, I belong to a hospital that is a public sector organization, and that is a recognized list as COVID-19 recognized tertiary care hospital. And as far as my perspective, the first case reported in Pakistan was on 26th February, when a young person, student, returned from Iran and got admitted at a private sector organization. And the very next day, we had the family of that guy, and it was a devastating situation where everybody has to rush that what treatment modality is available and how to deal with these patients. And the huge upsurge of the students who were in contact of that guy were coming to our emergency, and it was a rush situation. We were in contact of our provincial government, and provincial government supported us in a way that, as we belong to a public sector organization, so they funded every patient from screening till treatment. We had established a proper emergency for COVID-19 specific patient. The doctors were screening those patients who were referring from DHO or even from direct referral from other hospitals. Then we have isolation ward established at our unit. We designated those ward, and we had provided some essential PPEs to healthcare workers, physicians. Being pharmacists, that was our core responsibility to ensure the availability of the PPEs throughout 24/7 service. And similarly, we had the proper established Dow University lab services, where the screening was free of cost, funded by the government of Sindh. So this was the case where we dealt the situation, and that was very devastating at that time, as we were facing the lockdown situation. As Bisma and Huma already shared, that we had a strict lockdown at Karachi, and where after 5 o'clock, that was quite difficult for us to reach the hospital and ensure the supplies and availability, and the pharmacist present throughout the 24/7 service. So it was difficult for us, but though somehow, with the support of our leadership, the organizational administration, we established a proper COVID-19 hospital by the time. That is a 65-bedded hospital that unique to deal only the COVID-19 positive patients, and their patient is screened out. They get admitted at isolation ward. They shifted to ICU based on their symptoms and conditions. So now we have established a 65-bedded hospital within the hospital that is unique to deal with the COVID-19 patients, and this is separate from the other hospital. As of lockdown, we have shuttered down so many services like OPDs, dental services, everything. So this was the situation where every patient was suffering, because we have a huge upsurge of COVID-19 patients admitted at our hospital. So this situation is now, alhamdulillah, handling and managing by our organization, and now we are dealing with the situation with the support of Ministry of Health, Government of Sindh.
That's absolutely amazing. Fabulous service that you guys are providing, and I must congratulate you and your team for actually establishing this COVID-19 center within the hospital. Absolutely amazing. So if we move on now to our next question, And I think some of it's already been answered, but it'd be nice for our audience to have a little bit more detail about how you and your pharmacy team have responded to COVID-19. I mean, we've got a bit of an overview of your district, but if you could now just hone in and focus more on how you and your pharmacy team have responded. So we'll start again with Alamgir.
First of all, the problem faced was the availability of the raw materials, PPs, and other medicine as well. The major thing was one tweet that caused the whole world towards the chloroquine and hydroxychloroquine issue. And that was the same issue faced in Pakistan. Everyone rushed to pharmacies and bought the stocks of HCQ and the chloroquine. And even on government side, we had to purchase that because there was no basic scientific study, but still the use was being done at precautionary level or precautionary. Some doctors were using that medicine, and we had to manage that. And Alhamdulillah, still there was no shortage at all, and still we have a lot of bulk stock of these medicine in our pharmacies. As Huma told, that the only pharmacies were opened in Lahore and across the Punjab. Rest of all other shops and malls and everything was closed. And I salute all the pharmacists working in community side from association, from FIP, who stood like a warrior, true warrior, and faced the situation and did not cause any issue of the shortage of anything, medicine and all. And then second was the counseling issue, because at my side, I have seen a lot of issues regarding the use and the discarding of the PPs. The major issue was that, and there was no scientific based evidence on which we can use that, for how many days we have to use N95, for how much time we have to use the face mask or the gown. Then there were certain guidelines were issued from central level for all Punjab, which caused a lot of saving for us, because once we had an issue that even in one shift of doctor and other staff, they used 3 to 4 PPs in a one shift, because once they have to come out of their quarantine or HDU, they then going again and they use the separate PPs. So after that, we give some guideline from central level how to use these PPs and for how much time period they have to use. This was a challenge for us, and even for pharmacists, because most of the pharmacists in hospital level are managing the PPs and their distribution and logistics. And then the issue was the procurement side, procurement timelines, because of the lockdowns. And I have already told the quality issue, because quality was the major thing we have to focus, because our doctors and nurses and other pharmacists and other staff who are dealing in front line and dealing with COVID patient, they must be fully equipped with the quality material, because after the surge of these COVID-19, as I told earlier, that everyone rushed towards the manufacturing of these gowns, masks, and everything in Pakistan as well. But right now, we have established certain standards and specification, and currently there is no issue, alhamdulillah. And we are in Pakistan, uh, pharmacies, even like azithromycin was the drug whose raw material was monitored at central level on daily basis. We took the record from manufacturers, from distributors, from wholesaler, and from pharmacies. We allocated 5 to 6 pharmacies every district who could hold the stocks of azithromycin, HCQ, and other medicine which were probable to be used in these COVID patients. So all the things were channelized and managed very well, alhamdulillah, and everything is going fine. Thank you very much.
That sounds like a lot of hard work, Alamgir. So hats off to you and your teams for keeping this going and for ensuring access to PPE, but also not just access, but the correct use and the training as well. So well done to you. Lake, we've got you down the line. Lake, how have you and your pharmacy team actually responded to the pandemic?
First of all, I would like to say that when I hear Sir Alamgir Rao, I just think that we have done very less, because he's been such an inspiration. He's been working very hard during these days. So well done, Sir Alamgir Rao. And now I would like to speak to all the pharmacists around the world that whenever you have to win a battle, you have to collaborate, you have to generate your capacity. During the lockdown, the biggest challenge for us and for my that is going to be our capacity to deal with COVID-19 patients. So when I was scared the first of COVID-19, the first thing we did was, according to the guidelines, we set up different isolation rooms where the COVID suspects were being taken. Then we used to make sure of the proper cleaning, dusting, and proper infection of those rooms. Me and my team also collaborated with the 1122 rescue team whenever a case was to be taken to the hospital and to be taken back home or self-isolated or to be taken to the isolation room of the hospital. I also collaborated with the municipal committee in my area, which is a part of the local government. They used to come and clean the hospitals, so I used to make sure of that. Me and my team also, as you mentioned, wrote a book on the self-care strategy against the coronavirus, where we mentioned that how we prepared different preparations that were going to disinfect in the hospital and your daily household things. So there was a big challenge for us to increase our capacity. We directly reported to the different portals. We were given the portal by our CEO office, our THQ, and we were reporting directly to the CM Corona Cell daily. Me and the other pharmacists, we were given 2 shifts, and we were directly reporting the suspects, the confirmed cases, and the ones who were negative and discharged. So we worked on increasing the capacity. So we had to do so much, but we did great. And we also generated a mass awareness campaign on COVID-19. We were the first hospital in Punjab to release the guidelines or the in-house SOPs, which were like an example for all the THQs and DHQs to further follow. And I sent them to Sir Alamgir Rao as well. And I was continuously making videos on different aspects of how to deal with coronavirus, how a pharmacist can play its role, and how a team can uplift the existing condition and the capacity. So I was very much confident that we did well, and we did set an example for others to follow.
Absolutely amazing, Lake, and you're absolutely right with what you're saying. Pharmacists have a role beyond the dispensary as well, and this advocacy and campaigning and educating patients on coronavirus is just as important. So well done to you and your teams for actually taking a leadership role in that. Huma,
thank you.
How have you and your pharmacy team responded to the coronavirus?
Interesting thing is this, that I have too many teams. One team is National Alliance for Women in Pharmacy, who are like heads up and were in the front line to first give the idea of this guidance thing in Pakistan, and that I think benchmarked the things in Pakistan. That okay, and we just when we had this first draft together and we brainstormed, and you were talking about like how to handle the prescription, and I told you we don't have the prescriptions, we have the cell phones. so we added this point of disinfecting the cell phones, and this how we can save our pharmacy staff, and then use the face mask or not to. This was so way back in March that the face mask utilization was in a different aspect, and then WHO's briefings were changing every day, and everybody was asking us, because we are the only guys available in healthcare sector. We were available all the time in pharmacies. The people are coming, okay, whether we should wear the mask or not wear the mask, and how to do the things, and wear the gloves or not to wear the gloves, and how to dispose them off, and things like that. So first, I think the first step as a team was the development of the guideline, which I contributed with NAWP. And then the second thing, which I felt is my responsibility, now the guidelines are developed. The first thing I did the next day was to give my postgraduate students the presentations and lectures on how to use this guidance, and take a promise that they will train other people, because most of them are working part-time in pharmacies or in the hospitals. So they will go and in their workplace and implement those guidelines. And I, as practical side of the course, give them different assignments. So I gave them assignments. Okay, these are CDC guidelines of preparing disinfectants. Study them, and it's very easy. Make a small SOP and implement it. So they were now like visualizing information as a tool. It was not a book thing, not a theory thing, that this information which we study in universities is now relates to our lives. And this is, I think, the university and the teaching has taken another round, and academicians have also had to, refocus about what they are going to deliver. It should be objective oriented. If it is not catering the current needs, then what are we doing? So COVID has helped us redefine many things. There's one interesting thing, the shortage of PPEs and how we manage that. There are two important points I would like to bring in. Was not done exactly by me, but our pharmacy workforce in Pakistan. One thing, at the beginning of the pandemic thing, the beginning of the crisis, we didn't have registered hand sanitizers in Pakistan. And I think Alamgir would second it. Dr. Khalid Saeed Bukhari has told me from USP Forum that WHO and USP has done capacity building with ministry. And now we have around dozens of pharmaceutical companies having hand sanitizer as a registered product, which pass all the quality criterions. You at the start, few months back, you don't have any. And now you have so many registered hand sanitizers in Pakistan that you can even export it. So that's also in discussions whether we should start exporting. And so the other thing is this, that we were very much worried in the beginning about the drug shortages. Okay, it's lockdown going on. China is a big supplier. India is a big supplier. If the international, transportations are hampered, so people are, they tend to hoard medicines. And if the pharmacy and retail supplies will be cut down, what will be the outcome? Interestingly, there was a big hiccup. But now I actually remain connected with the retail because I teach pharmacy practice. So I remain connected with the hospitals and the retail teams. So they say now the supplies are coming. There are no obvious issues with the supplies. The drug shortages which were there before the COVID happening are still there. There are a few areas in which things are like gone down more, but generally pharmaceutical industry is running. The supply chain is undisrupted, and that's a big challenge amidst lockdowns. And having Karachi as one of our, fundamental unit where the most of the manufacturing sites are there, and that is under strict lockdown because the first major cases were started happening there. So this is also one of the big success, that the drug shortages, general drug shortages did not happen at our retail settings, which we actually anticipated in the beginning. So that's an important thing. The other thing I would like to second the efforts which the government made in making available the PPEs, because I am also a lead pharmacist in a clinical trial which is going on in one of the quarantine centers which is run by the government. And every day I see that they have enough. I don't go to the patient area. I sit outside and I do the medicine dispensing which is needed for the trial. I have trained pharmacists for that. And we take all the precautions when we're in the premises. But the teams have ample amount of PPEs, face masks, and there are protocols, chlorine showers and hand washes and everything. So it's very satisfying that the government's response is, day by day is augmented, and they are actually anticipating things and working beforehand. So that's very productive, and pharmacists are playing a very credible role in it because all the PPEs and face masks are in the custody of the pharmacists.
Amazing, and that sounds like, and you're very right, Huma, it's very challenging to keep up with these guidelines because the information that we're getting from WHO changes so rapidly because it's a virus that we've never seen before. So that is a challenge that we're dealing with and we're contending with on a daily basis. Bisma, how have you and your pharmacy team responded to the pandemic?
So being at the ministry, where policies are made and the key decisions are taken. So at an early stage, when there was like so much chatter, everyone was talking about safety of doctors and nurses, PPs, providing PPs to them. Nadia would have remembered that I just picked a call and I said, Nadia, what can we do for pharmacists? I mean, OPDs are closed, hospitals are closed. So how can we make sure that the pharmacists, pharmacy teams, they are safe? Because at that time, the realization was at a very low level that these are the people who will be in the direct contact with the patient, because as 80% COVID patients are asymptomatic. Anyone can be a carrier, and we wouldn't know. So that's put the benchmark for the guidelines. We have our sessions. Even the main component of the COVID testing criteria, we went back and forth with the ministry on that. Nadia would have remembered it, that okay, the COVID testing is for if someone came from abroad, if someone is traveling inter-city, if someone is feeling symptoms, what should they do? Or they should go for the testing, or they should isolate themselves. So these kind of thing. And then draft the main regulatory body of Pakistan, they adopted those guidelines as well. And then at the government level, there were slightly slowly the recognition of the pharmacists. They have been acknowledged that of course they are the main lead healthcare professional as well. They are frontline as well. And you guys are doing an amazing job. And the second most profound thing which has happened is the role of pharmacists in telemedicine. That has never been acknowledged before, but obviously the doctors and the nurses, they're handfuls in the hospitals, in the isolation wards, in the quarantine centers. So the pharmacists have the very main role in dealing with the symptoms, the minor symptoms, the COVID counseling and triaging, and we know we do it all the time in the pharmacies. We deal with the minor ailments, we prescribe them, we advise them on medications. So that's what the pharmacists have been doing in telemedicine. And recently, from the Yarani Watan platform, we collaborated with the doctors, one of our telemedicine partners, to incorporate pharmacists in teletrainings and telemedicine as well. So I think so that's a big thing which have come up because of this pandemic. That's another role which pharmacists can excel in and can actually take the burden of on healthcare.
You're absolutely right, Bisman. You're very right in saying that the pandemic really has brought pharmacists on the forefront, and we're seeing not, all over the world, heads of state, ministers of health are recognizing pharmacists as being the frontline heroes. So it's very refreshing to see. Asma, how have you and your pharmacy team responded to the corona pandemic?
Now you can imagine the situation, as my other colleagues already shared the situation. The same situation was with us. We are sitting in a hospital environment, and we had to ensure the availability of the drug and all essential PPEs. At that time, due to the strict lockdown, it was quite difficult to manage these drugs availability, especially chloroquine phosphate and HCQ. That was the drug of choice at that time. Though till the date, there is no proven biologicals and drugs to be effective against the prevention and the treatment of the COVID-19. But somehow everybody was asking CHQ and chloroquine phosphate and HCQ. And the PPE was the major issue. We were the only custodian at hospital level who has the custody of all PPEs, essential PPEs. Everybody was asking the PPEs. Everybody wants to have whole PPEs, including Tyvek suit, everything. Then we educate the staff, especially first of all our own staff, then the other staff, rest of the healthcare workers, where to use that PPEs. What are the essential PPEs required for the person who is sitting at pharmacy, who is sitting at ward, and who is sitting at ICU level. So this was the requirement where our pharmacist was at forefront, and they educate the people and they give proper guidance how to use these PPEs, what other drugs, remedies available and what other guidelines existing and are being using throughout the world. There are 42 clinical trials underway within Pakistan where certain drugs are using. We are using some of the drugs like anticonvulsants are using, hydrocortisone using. We have to ensure the availability of the tocilizumab, that is another a clinical trial drug. So that was our pharmacist role. Beside this, our pharmacists were also involved in the clinical activities. Earlier to this pandemic, they were part of clinical round, and they are providing and supporting physician in terms of the drug regime and protocols development. But once this inception happened, we took them out from the ward and tell them that please communicate on online telephonic conversation and give the suggestion on the dilution and the dosage of the drugs that are being used. I will be sharing some experience with the chloroquine phosphate. Some of my colleagues asking for chloroquine phosphate very rigorously. I asked them, why are you asking chloroquine phosphate? They said, we want to give them, we want to give the preventive dose to our elderly parents. Then I inquired, do they have any comorbidities? Yes, they said yes, they are hypertensive, they are cardiac patient. Do you know there are certain adverse effects associated with the use of these anti-malarial agents? Then they realize that their pharmacists, how pharmacists can provoke, how pharmacists can guide them, how to use the drug, what benefits and potential outcomes associated with the drug, and what adverse effects can happen to the use of or misuse of the drug. The misuse of the PPs was another issue. I will not go in detail, but at that time, the PPs were out of stock. You can imagine the face mask that cost around 5 to 10 rupees were reached to 40 rupees per face mask. Everybody are rushing and coming to us that please give us face masks. Then we manage the inventory according to the need of and according to the consumption, because we have to be responsible against those patients who are really in need and where the healthcare givers are providing safe and effective care to them. So this was our core responsibility being pharmacists, that to ensure the availability of PPs and as well as the essential drugs. And that was very difficult time for all of us. And now, alhamdulillah, everything is settled, since our government, Sindh government, is supporting us in terms of the free cost treatment, and we are managing donations by the provided by the even the government and the NDMA, or even the private NGOs are providing us some PPs for our patient and healthcare.
That sounds absolutely amazing, Asman. We're in a very challenging time, but the Sindh government have also been commended on their response to the pandemic. So once again, congratulations to you and your team. So time is running short, and I am very much aware that it will be time for you to break your fast in Pakistan as well in the next 10 minutes. So as we before we close, it'll be nice to hear from each of you one final time. And what I'd like to ask you is if you could say one thing to the pharmacy workforce around the world, a message during these very difficult times. What would your message be? So a nice, short, sharp sentence. And we'll start with Lake. So Lake's on the line.
Yes, okay. I would like to say that you must have heard the quote that you cannot go to the pharmacy to buy a pack of experience. You have to be in those games in order to acquire that experience. So be in the game, inculcate the idea of becoming a leader and become a leader in your profession. Take the challenge, face the challenge, do great things, and then showcase and share with others. If someone replicates the idea or the good work, then you are a successful pharmacist. And that's my whole idea of being in this profession as a leader.
Thank you, Lake. Alamgir?
I would just say two things for one line. First thing is that do fight like a warrior, not a coward, in the situation of COVID-19. And second thing is don't spread misinformation or unauthentic information. The major issue in Pakistan was the misinformation. Every corner, even you can say that use of medication or other alternatives just on hearsay basis was the major challenge. So don't spread any misinformation or unauthentic information. Thank you very much.
Thank you. Huma?
Yes, I would go with what Laik has said, and I would phrase it in one sentence: be connected, updated, and empathetic to the situation. Together, we can beat it.
Amazing. Bisma.
Inshallah.
Yeah, so one thing I would like to say is don't let the momentum which has been built in the COVID fade away. Be vocal about profession, be vocal about each other's successes, and support each other. That's all we can do.
That's great. And finally, last but not least, Asma.
Yes, I must say you are forefront warrior against this pandemic COVID-19, and please provide outstanding care and education beside doing your professional duty.
Absolutely amazing. And with these powerful messages, we will wrap up today's episode. But before I end, I have a special message from the team at WHO. They've launched their COVID-19 app, both on Apple and Android. So please do download the app, and it's available in several languages. And it's a very, very useful resource. I would like to sincerely thank our heroes and our partner, the Polish pharmaceutical group, for the Pharmacy Heroes. This episode has been recorded and the recording is freely available on www.fip.org/coronavirus, a webpage that includes all of our COVID-19 resources. This is an opportunity for me to invite you to also join our new Facebook group, which is called COVID-19 and Pharmacy, where you can join a global network of pharmacy discussing the pandemic. If you'd like to feature in one of our upcoming Hearing from Our Heroes episodes and share your story, please can you email Lina Badr at lina@fip.org. Thank you so much, everybody. Thank you once again to our panelists. Enjoy your iftar. Thank you, and have a great Eid, everybody.
Welcome.
Thank you.
Thank you.
Thank you,
Eid Mubarak.
Nadia. You too. All of you have a great Eid.
Stay safe. Stay home.
Thank you.
Stay safe and stay home. Bye. Allah Hafiz.
Khuda Hafiz.